how do you decide which processes are appropriate for automation, really without compromising the human touch? And how do you keep that human touch even when processes are being deployed as well?
So I am trained in the Stanford biodesign philosophy. So
Yeah.
I'm very much a big fan of needs-based innovation. So I really look to see where things are causing a problem in the clinical setting. And it's really important when you try and find a problem that it's a problem that affects multiple stakeholders. So it's not just a problem for the nurses. It's not just a problem for the patients. It's something that affects everybody. And I really saw that need in things like care coordination, in patient education, in trying to track outcomes. This was really a problem that I realized nobody was really able to solve. And I realized very quickly that we could use technology, not necessarily cutting edge brand new technology, but use existing technology and existing frameworks to try and make this something that we could make very effective, very frictionless, and very cost effective. And that's sort of how the AI registry that KKH and BotMD have sort of collaborated on came about. It sort of was the philosophy. It's like, it's really hard for us as surgeons to track the outcomes of our patients. And, on the same way, the patients really want to know, like, when can I go back to sports? When can I do football? When can I go for OBS? Or I'm fit to go back to swimming on the beach and stuff like that. And, the nurses and the physiotherapists, they're slammed. They have no time to track this sort of data. And so looking at the solutions, I approached BotMD. I was like, for better or for worse, kids are really great with phones and digital devices. Young parents are very tech savvy. Everybody in Singapore has WhatsApp. What if we used WhatsApp to collect that data asynchronously? And we could make it so easy and so frictionless that they could do this in the comfort of their own home. They don't have to come down, and we can flag them. On our end, we could track this so much better. And in this way, we sort of found a solution where it appealed to the parents and the patients really well. It was so frictionless and easy for the healthcare workers. And dollar for dollar, it was just such an attractive option that it made implementation so seamless. And when you try and align your stakeholders that way, if you can find a problem that cross-cuts across all of your providers, your patients, your physicians, your payers, then you can really find a solution. If your solution can satisfy all of these people, then implementation really becomes just a matter of knocking on the right doors and showing them the evidence.